So I want you to put your hands on your belly. And I want you to send your inhale down into your navel, to that center area right above L3. And I want you to fill it up with air, whatever's comfortable. Remember not to overbreathe. So you inhale, you feel your belly rise up to the ceiling. You exhale, you feel the tissues float back down. This is a very good place to start with new students with the breath. It's easy to feel your belly when your hands are on your belly. They help you feel more safe. So it's a good way to start going in with people who are new to it. So you have a right lung and you have a left lung, and they're very different. It's complicated, I can't explain it right now, but we'll just know that while they're very different, they do mirror each other very much the same. Your right lung has 3 lobes. The lobes have sliding surfaces. So I want you to focus inhaling into the right lobes, all 3. Try to go for the lowest lobe first. That's the one at the bottom of your rib cage. You might feel your back of your ribs on that right side open up like little fish gills. When you exhale, you just let go, let the air fall out. There's no particular need to exhale a specific way. Wait for your next breath to inhale. So focus on that lowest lobe of the lung first. Really try to send the most amount of inhalation energy into it. And notice the effects that that opening creates, not just in those lower ribs, but along the spine. Now take your awareness to your middle lobe. Just imagine the middle portion of that right lung is just fine. Inhale into it. Kind of think bra line area in this case. Sending all your inhalation energy there. It's not like you're not going to breathe other places. You will. The air will go other places, but you're trying to point it towards that area. And now take your awareness into the upper lobe of the lung, sending your air into it. Now, if you have a tendency towards panic attacks or hyperventilation, breathing into the uppermost lobes of the lungs can trigger a nervous system feedback loop that can initiate that. So be very careful with upper lobe breathing with yourself and others. If it irritates your nervous system, starts triggering it, just don't do it. But imagine passive air moving through that upper lobe. So the breathing diaphragm on the right side is a different shape than the left side. The right lung is 3 lobes. And try now to breathe down the entire right side, using that right lung to open up all through your lumbar spine, down into your hip joint and your right pelvic floor. Can you send an inhalation all the way down the right side? Now I want you to take your awareness into the left lung. Just breathe into the left side now. Of course, you're going to breathe other places too, but you can direct a lot of the air into the left side. The school books often say that there's 2 lobes of the lung on the left side, but dissections show some people have 3. So we'll just imagine there's 3. It's okay to imagine there's 3 so you can direct your breathing. So try to breathe down into the lowest. If you had 3 lobes on the left side, go to that lowest lobe. Direct all the air into there. Now imagine you're one of those people that happens to have the middle lobe of your lung. So breathe into that middle lobe. Now breathe into the upper lobe. Again, if this triggers your nervous system, don't do it. Just imagine it. And then breathe through that whole left lung, all the way down the left lumbar spine, all the way into the left hip joint and left deep pelvic floor. Let the inhalation wash through down all those bones. Let it open all those spaces. Let it open the hip joint. Let it open the pelvic floor. Let it spread the lumbar spine on that left side nice and open, giving those spinal nerves space. Now, I want you to notice where your heart is in your chest. It sits right on top of the breathing diaphragm. So do the lungs. The pleura of the lungs attached to the breathing diaphragm. That's how they're pulled open on an inhalation. And as you inhale deeply, your lungs squeeze a hug around the heart. So good. Squeezes that heart muscle, which gives it a massage. And when you exhale, the lungs recoil away from the heart. So breathe your lungs directly towards your heart. Try to encourage that heart hug with your inhalation. Notice those lungs moving towards center. They don't just move towards your ribs, towards the outside. They also move towards center. Feel them move towards center. Let that fill up your rib cage and give it support. Now we're going to explore the sternum. So you take your hand, you put it right on your chest. That hard bone right there is called your sternum. Put it on your hand on it. I want you to imagine like a water pump. You know, a water pump, you pull the lever out and you push it back down. Your sternum's shaped like that kind of, and it moves like that. When you inhale, the bottom of the sternum picks up like a pump handle. So feel that sternum lift up towards the ceiling, especially from the inferior portion, the lower portion. You get to be curious about that. So the sternum should move with the breath. And then also you have another joint. So find your jugular notch. And the bone you feel right below that, between your two collarbones, the bone right below that is your manubrium. And it attaches to your sternum. It's the sternomanubrial joint. I want you to take your 3 fingers, put them right on your manubrium, and make sure you're touching what feels like the top of your sternum. If this is new to you, don't worry, you'll find it. As you inhale, the manubrium and the sternum should open apart. Spreading apart, the manubrium comes to the sky in its own direction. The sternum goes to the sky in its own direction. As you exhale, they fall back through gravity to the ground, which for them, your heart and your lungs. That's okay, you'll find it. Let that manubrial joint open with the inhale and close with the exhale. And now take your awareness to your right and left collarbones, your clavicles. As you inhale, let the lungs open the ribs underneath the collarbones so that they can go wide and open on your chest in the inhale. You're not trying to move your spine other than opening it with your breath, moving the ribs with the breath. So don't try to move your body to accommodate this, like from the outside muscles. Try to use the breath and feel how the collarbones open and go wide. Collarbone placement in Pilates and any movement profession you happen to be in is paramount. So easy for the collarbones to not be in a good position because they float around on the ribs. Deep breathing underneath them gives them ground to find how to organize. So let your inhalation tell your collarbones about where the ground is so they know how to organize. Now take your awareness into your shoulder blades, those scapula on your back. They're sandwiched between your ribs and the floor. They're in a closed kinetic chain sandwich of sorts right now. Particularly, try to notice the shape. Imagine the shape of your scapula. As you breathe, try to send your breath into the ribs that touch to the scapula to help you try to sense the shape of the scapula. It's triangular bone. When you inhale, the medial line of the scapula, the 2 straight lines that organize towards the spine, they widen on the inhalation. Try to encourage that. On the exhalation, they soften back towards the spine a little bit. Send your awareness down into the back of the armpit. Can you get your breath into the back of the armpit so it feels like the back of the armpit goes nice and wide? Can you use that inhalation to encourage width, to encourage space, ground underneath the glenohumeral joint so it knows how to organize? And have a sense that you can imagine the head of the humerus there floating underneath that back of the armpit, that back of the scapula, upper portion. Can you inhale into that joint? Notice the head of the humerus living there Gets a little space. Now we're going to go back to the spine. I want you to start with your head. Notice as you inhale that your soft palate changes positions, your ears widen, all the bones of your skull come apart. So inhale into the skull bones, the face, the soft palate, the ears. Feel all that space that's created in there. Your soft palate is directly in front of your cervical spine. So take your awareness deeper through that soft palate into that cervical spine. And inhale and feel the length of the front of the cervical spine bones as you inhale. Send the inhalation down the thoracic spine. All those little riblets help open the thoracic spine. Not all of them. Most of them do, though. They help open the ribs, push down on the transverse processes in the thoracic spine and push them open. So use your inhalation down the front of your cervical and thoracic spine to open those spaces. And now let that travel down into your lumbar spine. Notice how your breath opens the lumbar bones. Inhaling into the sacrum, feeling the sacrum counter-nutate on inhalation and nutate on exhalation. Feeling the inhalation going all the way down the coccyx, uncurling it and opening it. And now get yourself into a position you can do some articulating bridges, okay?